Dr. Megan from Balance Within PT. So today I want to talk about urinary incontinence, which otherwise known as peeing anytime you're not trying to. So this can be anytime, day or night. It can be a few drips that you leak of urine when you hear the sound of running water, or it can be a full-on wardrobe change needed after a big sneeze, anywhere in between. So anytime urine comes out where you're not planning on it is considered incontinence. And there's lots of different causes of this sort of thing, and I just kind of want to talk about it a little bit today. So incontinence is really common, and unfortunately it's really common, but it's not normal, and there's so much that can be done to help out with it. Things, women who've had children certainly are more likely to have incontinence. They have an increased risk of it, but it can happen at any age, whether you've had kids or not had kids, and men can get it as well too. And there's help for all these different populations out there. There's so many things that can contribute to incontinence, so it's multifactorial. There's a lot of different contributing factors. One big thing is looking at your pelvic floor and looking at the strength and flexibility. So your pelvic floor muscles, they're the muscles on your bottom of your pelvis, and they have a lot of roles, but one of them is helping with going to the bathroom. And in order to work correctly, they need to be able to fully contract and fully relax. And if one of those is off, whether it's weak or if it's tight, leaking can happen with that. I get the question often, should I just do Kegels? That'll take care of all my issues. And the answer is it depends, but it usually doesn't. So if you truly just have weakness in your pelvic floor, Kegels can be really helpful. It can help to strengthen those muscles. However, if you're not sure if you're contracting them quite right, if you're not sure how your control is, or if your muscles are actually tight instead, it can make it worse. And without having a pelvic floor assessment, it's really hard to know those factors too. So I always hesitate recommending Kegels without having someone evaluated first, because it can potentially make the problem worse, or it just might not be helpful with it too. So in a PT session, what I would look at with someone who comes in with incontinence is first take a really big history to figure out just everything that is leading up to it. I'd also want to look at your posture, look at how your body mechanics are, how you look when you're squatting or getting out of a chair, or when you're lifting something, because if you're bearing down or putting a lot of pressure down when you're doing that, that can definitely contribute to incontinence when you're coughing or sneezing or lifting weights in an exercise class. So I want to get you moving and see how your body moves. Also want to check your pelvic floor strength and flexibility. Check your lower back and pelvis flexibility, your core strength, a whole bunch of different things. There's also things that you might be eating or drinking that can contribute to incontinence as well too, so we want to go through those. And then a lot of times there's a big behavioral component too. So if you're someone who tends to run to the bathroom before and after every workout class, or you see a bathroom and you know you're going to be in the car for 10 minutes, so you think, well, I'll just go just in case, just to get a little bit out. Those kind of things can kind of send this mixed signal to your brain of thinking it needs to go when it doesn't, and can lead to incontinence. So definitely we talk a lot about different behavioral strategies that can help out with improving it. Hydration is really important too, so making sure you're drinking enough water, which can sometimes seem counterintuitive, but getting enough water is really important to helping prevent incontinence. So there's a lot of different things that we're gonna look at, different components in therapy, and a lot of different ways that we can help you out. So there's also different types of incontinence too, which I'll get at too in a future video, so stay tuned for that, because we treat it a little bit differently, and sometimes you can have a combination of those as well too. So if you're dealing with any of these issues, they're really frustrating, they're really embarrassing, and there's so much help for it out there. So I strongly recommend you give us a call, and I'm happy to discuss it with you to see if it would be a good fit. You can check out our website at balancewithinpt.com for a lot of great information as well too. But just know that again, these are common but not normal. There's a lot of hope out there. You don't have to live with this. Even if you've just had a baby and you've just been told, just live with this, there is a lot of great resources out there, and a lot of ways we can help you to get rid of it completely and let you get back to your workout class without having to run to the bathroom 5 times during it, or having to always bring those spare clothes because you're just afraid of having those leaks. So we'd be happy to help. Give us a call or check out our website. Thank you.